it was an ad in the paper that Ellen Marie, my wife, saw, and she made the connection for me.
Good for her. Well, we are really in her debt, aren't we?
Oh my gosh, yes.
Yeah.
She's the one that pointed out the ad in the paper for the job at the hospital. I started out at the maximum security. Well, she saw the position, and so I applied for the position, and so yeah, I owe her a lot. And
then she saw an ad for the mediation.
Then she saw an ad for the volunteer position.
Why don't you read the papers more?
I'm not inclined to, improve myself these ways, but someone else is, thankfully.
That's good.
Yeah, she saw it, but she took the class with me, so she was very much interested in it also.
At the Dayton Mediation
Yes, yes.
And who was running the Dayton Mediation Center?
Well, it was the city of Dayton started this program because, for whatever reason, and they brought in a consultant who had experience starting a mediation center. He was a professor at Wright State, and they paid him to set up the structure and to teach the first several classes. And I was in the first. Ellen Marie and I were in the first volunteer class
as volunteer mediators.
As volunteer mediators.
And then you continued on as a volunteer mediator for
5 years.
5 years.
5 years.
And that you were still doing the EAP thing for those 5 years?
No, things changed. So it's like a whole nother little cycle here we can talk about. But yeah, the EAP EEO work brought me to the attention of another agency in the state that was helping set up systems in private industry and public entities. And so I actually...
EAP systems.
EAP systems. So I took that position with the state, and I was exclusively setting up systems in companies and in government, and training the staff and the employees, training staff how to notice performance issues and what to do about it, and to refer to EAP, help them set up policies and procedures, and orient the staff and connect them to outside agents, counseling agencies. EEO thing was over. That's right.
So the volunteer mediator thing is coinciding with this EAP systems
Right.
This is off track a little bit, and it's pushing a little bit, but I'm curious about it. When you got into the EAP work yourself, which sort of grew out of your work on the team unit leader thing and your special ed graduate work, there was this sort of philosophy that you brought to it that, look, EAP means we don't throw people away, we look for ways to help them access their strengths and therefore perform better, which is not only good for the bottom line, but it's a better way to relate to people. It's truer to my idea, Tom Wahlrab's idea, of who people are and that they deserve help and support when they encounter problems, not discipline and firing. So that's how you came into this. When you became an EAP systems constructor, did you consciously import that philosophy and in your construction of the systems and your training of the folks to do it? Was there a philosophical element to your training?
I think what you described is actually the way the literature explains employee assistance program.
I see.
So I'm not necessarily bringing in anything unique to me. What I would say that I brought is that when there are performance issues exhibited by an employee that's caused by personal issues, there's extreme pain in that person's life. I would call it pain. There's dysfunction, there's hurt, I'm going to generalize and say there's pain in that person's life, and in their distress, and there is the faking it that you're okay. The last place that's convincing is in the workplace. That's what the research says. So that means that this person who's performing badly supposedly had been performing well and now is performing not so well. They've already hurt people in their lives or been hurt or whatever. There's distress in their lives. And that's hard to take in and accept and just act like normal.
Right.
So if you could be in the world and do it in a way that creates systems and organizations that respond to that and do something to reduce the pain, that's a good thing to do. So it's a worthy thing to do. So that's the thought, the experience that I brought to my EAP, the reasons why I was doing it.
Okay.
Bottom line was fine. And that was helpful. That was a convincing argument.
Right.
But that's not why I was in it.
Now, I'm going to pick at this bone just a little bit more if I can, which is, I was going to say, in a certain way, so your Tom Wahlrab's orientation towards the people he was working with, helping, resonated with the sort of formal theory of the AP literature that you discovered in your graduate studies.
Yes.
There was a consistency there. At the same time, I'm kind of resisting the idea that, well, really what you can see is, if this is the way literature puts it, the dysfunction here is really reflecting distress over here. And there's pain and distress there. And rather than just sort of continuing to beat this guy over the head and then fire him, and the pain just is continuing over here, let's do something to help relieve the pain and distress, and that will also, by the way, cure the workplace dysfunction. So fine, that's fine as far as it goes. Curing pain, relieving pain, is, so this may be too much of an overlay, but you can relieve pain in a number of different ways. You can relieve pain by some sort of external infusion of pain reliever of one kind or another. Or you could relieve pain by helping the person in distress access a deeper level of health, strength, calmness that gets beneath the pain, basically. I'm not sure that that's good medicine, but good medical theory. But that's sort of conceptually. Again, it's like top down, bottom up. Are you, and I'm just curious, I know nothing about this, is the EAP, did the idea of, we're not trying to sort of, tell this person how they can run their life better. I think you need to seek help over here, over there, over the other place, or does an EAP counselor, because I assume there's something called an EAP counselor at some point that works with the person. Does the EAP counselor try to work with that person to help them identify where the problem is and how it might be solved? Do you see what I'm getting at?
So I worked with a company. I didn't have to convince them to start an EAP. They called me. They were ready. What they had done for several years is that they had a CEO that was drinking, and they helped him hide his performance issue that everybody knew was caused by drinking. He even had to go to New York to be with the big bosses periodically. How did they do that? But they worked really hard. The management staff worked really hard to get him sober, to do whatever he had to do to perform to the few minutes that he had to perform well. And in the meantime, he'd come back to this area and do his job barely, and they did everything else. One day, he put a gun to his head and killed himself. They realized that everything they did to figure out how to help him backfired. They needed to go help him and any other employee now, because hey, if it happened to him, it's probably going on elsewhere too. And we could probably find examples if we dig how we're enabling other people on the job, not just the CEO. That's not our forte. We're not trained to do that. So let's figure out how we can get people who know what they're doing, whatever that may be. So it's not the counseling. The field of counseling isn't about telling people how to do it. Now, I'm sure there's schools of thinking around counseling when they will tell you what to do. Now, is that effective? Well, I would say no. But I'm not the counselor, and I'm not evaluating. I'm not assessing the fields of counseling. But my understanding is that counseling works with people to understand themselves, to figure out what their options are, to do what they need to do to get better and to function at a higher level and reduce their pain in their lives and the suffering.
That was the approach of your whatever it is, consultation, training, work with these clients that you served as the EAP systems person.
Right, and when I would connect with them agencies in the community that did EAP work, it wasn't those agencies that had a philosophy where they told people what to do.
Right.